The Canadian Dental Care Plan, CDCP, Dental Care for Seniors. The Canadian Dental Care Plan, CDCP, is one of the country's largest social programs, and it is expected to make the cost of dental care more affordable for up to 9 million Canadian residents. If you are a senior citizen aged 65 years or above, you may be covered under this program provided you meet the Plan 4 requirements. You're a Canadian resident for tax purposes. Your annual adjusted family net income is less than Canadian dollar 90,000. You and your spouse or common law partner, if applicable, must have filed your tax returns in Canada so that your family income can be assessed for the previous year. You don't have access to dental insurance. If you have dental coverage through a provincial, territorial, or federal government social program, you can still qualify for the CDCP. The services that could be covered under the CDCP when recommended by an oral health provider includes but not limited to dental exams, including complete, routine, specific, and emergency exams, x-rays, cleaning, scaling, fluoride applications, sealants, temporary permanent fillings, pain control for diseased teeth, treatments for cavities, root canal treatments, pulpectomies, first step of a root canal treatment, retreatment of previously completed root canal treatment, cleaning under the gum line, treating abscesses, bonding for mobile teeth requires pre-authorization, gum disease management, posts and post removal, repairs to crowns and rebonding of crowns and posts. Crowns requires pre-authorization. Post for crowns requires pre-authorization. Partial, complete dentures, including standard and temporary dentures. Denture repairs, relines, and rebases. Placing lining and dentures to condition oral tissues. Removal of teeth and roots. Surgical removal of tumors and cysts. Surgical incisions, including draining. Treatments for broken jaw bones. Minimal sedation, conscious. Moderate sedation requires pre-authorization. Orthodontic services, these are not available yet and will be added in 2025. The CDCP will reimburse a portion of the cost of your treatment, but it may not pay the full amount. You may have to pay additional charges directly to the oral health provider if your adjusted family net income is between $70,000 and $89,999. The cost of your oral health care services is more than what the CDCP will reimburse for these services. You and your oral health provider agree to services that the CDCP doesn't cover. You may have a co-payment based on your adjusted family net income that you will have to pay directly to the oral health provider. Your co-payment is based on your adjusted family net income. In case your adjusted family net income is lower than $70,000, 100% of eligible oral health care service costs will be covered by the CDCP, and the treatment will be free for you. It is advisable that before receiving oral health care, you should always ask your oral health provider about any costs that won't be covered by the plan. Make sure you know what you'll have to pay directly to your oral health provider before accepting and receiving treatment. If you meet the CDCP requirements, you can apply online or over the phone at any time. This is a very simple application. You will need the following information for the application: social insurance number, date of birth, full name, home and mailing address, list of dental coverage through government social programs if applicable. You and your spouse or common law partner, if applicable, must have filed your tax return for 2023 and have received your notice of assessment. Once the application is submitted online, you will receive a confirmation number so that you can check the application status. Once your application is approved, you will receive an approval letter. Subsequently, Sun Life, which is managing the plan on behalf of the Government of Canada, will send you a welcome package by mail. Your welcome package will include your member card and all other details about the plan, including the eligible cost.